It's so important for people to be able to access green spaces, and all of our literature tells us that, the research is there. We don't need to ask that question, but we do need to help people get connected into nature. And there's lots of barriers to that, and we have to work out how we overcome those barriers, or how we help people to overcome the barriers for themselves.
One of our key missions is to embed social prescribing, and particularly green social prescribing, within the health and care system. And we're working at every level to enable that to happen. So that involves influencing strategically with decision makers within the health and care system, right through to working with providers to showcase the value of what they have on offer and to demonstrate the impact that that has on people's mental, physical and social well-being. How we do that involves, I think, some key changes across the system, and for community-based activity and communities and people to get much closer to clinical prescribing, and for us to mesh that so that there is true collaboration and we all have a common understanding of what's available and how to access it. There is an expectation that when someone is referred to an activity, they will just turn up, and they often don't, because there are so many things going on in their lives. I think if we could do more to support communities to help people within the community to access nature in an easy way, then more people would benefit from green space and nature-based activity.
We set up the Green Provider Network quite early on and got people to complete surveys to share information with us about what they already delivered, so we could get a picture of what was on offer around the city and county. We have a couple of districts in particular that are quite rural, and then lots of small ex-mining towns, and some challenges around deprivation and social mobility. So we decided to focus on different things in each of the districts that related to the needs of the people there. Started to investigate all of the points in the referral pathway where there might be blockages and challenges, and that's what our testing in each of the districts and boroughs has been focused on, to draw out those different elements. So how people access, whether they have transport challenges or whether they have the equipment to be able to attend, whether they have the confidence to get there themselves or whether they require support to do that, whether they could maintain an attendance without ongoing support, whether it's the right activity for them, and then whether they are the right participant for the provider. So if the provider isn't resourced, as they often aren't, and they rely on short-term grant funding, whether the provider has the skills to support the person's level of mental health need and any other needs they might have.
Referrals through healthcare systems are now starting to happen, but we took the decision just to rely on those from the get-go would probably mean a large period at the beginning where you get one person, two people. Projects like this take a little bit of developing. So just by allowing people to self-refer, once they know that a project is there and people enjoy it, they will often continue to signpost people.
I think as OTs, we do prescribe green health activities without even really thinking about it. So it's something that we're just trying to kind of bring to the fore and ensure that it's part of our assessment process as well.
The green social prescribing and nature-based activities are already there. People are already working really hard. So actually it's really important that people look at their system and think about how is it that we are going to understand and promote these activities. We do need to make sure that if we value something as an alternative prescription to medication, that we actually pay for it and we actually value it in the right way.